But one of the women I interviewed, still friends on Facebook, and she's a mother of 2 children. She got a new primary care who refused to give her a vaginal exam. Clearly, we are still dealing with prejudice or not knowing how to do it or how to ask questions. And this is not right, because even if you aren't a parent or sexually active, you should be getting a full exam and knowing what it's about. I'm on a Facebook page for women with cerebral palsy, and I'm also surprised how little they know about their own disability. So I think there has to be a lot more education done so people know what their disability is and what the implications are to both their physical health, not only with one woman I was just dealing with on Facebook has increased spasticity, but she didn't know, she could have a herniated disc. What are the differentials? But not only that is an issue, but what are the issues if you get breast cancer? When we talked about dealing with breast cancer, and what does chemotherapy do? And what are the implications of chemo on your body? So there's a lot more that we have to deal with. But with pregnancy, it's also an interesting thing, because we have to look at not only the physical issue of pregnancy, like can I transfer, or what are the side effects and how do I deal with the fatigue? But then what are the issues during labor and delivery? And what are the complications that can arise? And how do we take care of that? And then, as someone talked about the women with coercion, there's a number of you that have been working on looking at coercion. And long time ago, I met a woman at a conference who was trying to get a woman in a nursing home who didn't have language. And it was clear she was raped. And why would she want to bond with her baby? And I said to the assistant, maybe you're coming at it wrong. Maybe she doesn't want to deal with the baby. Just because she gave birth to this baby doesn't mean she's connected to the baby. And you need to find that out. So I'm glad that a lot of research is happening.
Can you briefly define coercion for people who may be less familiar with the research? This is Meg.
I'm going to turn it over.
Yeah, so when we talk about reproductive coercion, we're talking about someone who forces the partner, the woman, to have sex and to have a baby, actually. And if the woman refuses, then the partner, the intimate partner, threatens to hurt the woman, or stop supporting her or whatever. So I mean, I think that this is a big deal. So women are having babies or becoming pregnant because of this coercion, because they are without choice. There are too many implications, too many losses not to go forward. So yeah.
This makes me realize we're dealing with a new issue because people can't get abortions.
Right.
So this is complicating the issue a lot, because that's making a victim 3 or 4 times what's happening in Texas, where the man is able to sue his wife or ex-wife's girlfriends to trying to help her. I mean, we have a lot of work to try to change the perceptions in the congressional areas of each state.
And reproductive coercion is a huge problem for women with disabilities. We're finding out from our research that in one particular study, one particular sample of women with and without disabilities, 6.2%, I'm looking down here, of women with disabilities reported experiencing reproductive coercion compared to only 2.8% of women without disabilities. So it's a huge issue and it's not being addressed at all.
Thank you, Rosemary. I mean, because I work where I'm trying to help women be able to choose to become
Yeah.
parents. When I did my study, it was just the opposite, where a woman who was 5 months pregnant was offered an abortion, even when abortions were illegal, because they couldn't see that she would want to have a baby. And yet this woman who had spina bifida, was the head of special ed in Berkeley. So it wasn't like she was an uneducated woman.
Do you remember, Judy, this is Meg. Do you remember the moment when you decided you needed to write a book?
Yeah.
Talk a little bit about the book.
So I was at Center for Independent Living, or the original CIL, and I was one of the only women who had a baby. In fact, I missed the 504 sit-in because I had a 5-month-old. But someone came up to me and wanted information on being pregnant and being the only mother. I go, oh yeah, I bet there's a whole dearth of information. I better, why not write the book?
And what has been some of the feedback you've gotten back over the years about the value of?
I just got a strange feedback. I feel they're doing a study at university in Pittsburgh at one of the hospitals, and they contacted me yesterday, and she called me a rock star. I'm going, really? No. But I guess they enjoy the book, that they're giving the book to their patients who are giving birth. They find it useful. And when I've been on Facebook or saying something, because someone, says, oh, my kid is 21, I go, really? Where did that go? And they say, thank you for your help. But it's been more around the parenting than the pregnancy. And a lot of times, again, the lack of information, where doctors are giving women unnecessary C-section, which makes recovery harder than if you didn't have it. Women without disabilities have a difficult time, many times, recovering. And then it makes it more difficult for breastfeeding. And I just have to say, for a natural thing as breastfeeding, I've never seen so many issues. How did we survive infancy? I mean, I can't believe the number of people where the baby doesn't want to latch on. And what's happening is women pump and give the baby a bottle now. Yeah. The struggle that was been going on is so hard. And again, we don't have all the medical knowledge about milk production. I interviewed a woman who was spinal cord injured. One breast was at a T5 level, the other one T4, and she was able to have milk production on the T5 breast. And yet a woman who was a C6 quad had enough milk production. So clearly we don't know enough about women's breasts. It's back to when my husband was in medical school and they realized that they can't treat women the same as men for heart disease. I mean, we're just talking, we all have hearts. I swear to you.
Right.
Some in Congress I may question, but we all were born with hearts. So, and yet it took till the 70s to say, we're not recognizing how women differ with symptoms, treatment, and what have you. And so I think the whole issue of breast health, from breastfeeding to breast cancer, gets overlooked because we don't have the information on what's making breastfeeding difficult, and why is it more difficult now than ever before? Or not ever before, I mean, I've been doing it, and it took me the first time days to have my daughter latch on. Because the woman in the bed next to mine in the hospital, she was lying down. I couldn't lie down. There was no breast pillow the way you can go by it. And I had to figure out what was the good position for me to be in to support my baby and support me,
So you wrote a book, This is Meg, but you also at a moment, I'm imagining with other people, you decided that there was also a need for support, peer support, and through the Looking Glass organization.
Megan,
And I'm just gonna be the timekeeper, which is weird. I know that people will laugh at that, but we do really want to open it up to discussion. So
Okay.
I'd love to hear a little bit about that. And then if we have time, maybe come back to the videos.
yeah,
Okay.
no, that's fine, because actually other videos that were on a different drive I left at Alexandra's house. So I didn't correct you. I came in, Megan Kirschbaum started it. I was her second employee, and the OT, which was, she's a psychologist, and she was looking at emotional support for parents. But she recognized that there needed to be adaptations for parents, that back in the, not even in the 90s, baby care equipment wasn't user friendly for anybody, but particularly parents with disabilities. Now it's worse. They stopped doing the drop down crib because some kids have died. And if you're someone with a physical disability or just aging and a grandparent, it's hard to throw the baby into the crib.
Yep.
You're gonna can miss. And
It's hard for able-bodied moms.
yeah, well, that's the point. I had a chance to talk to consumer, to the man in charge of consumer product safety. And the true starter of Through the Looking Glass wouldn't let me go because he was afraid we'd get in trouble because we use an adaptive crib that slides through the side, making it easier to get babies out. So it's really hard. And what breastfeeding or pregnancy causes is other disabilities of carpal tunnel and difficulties needing your hands. So when you're having that already and you have to place the baby into the crib, can be quite difficult. But you want to turn it over to, I would love to.
Well, I just want to say, I mean, I think, that kind of national center has really created a model. And Mary, maybe you have some insights. This is Meg, by the way, have some insights about across our rural centers for independent living. I mean, how many are having peer support groups for parents with disabilities? I'm thinking about Latoya Maddox's model work at Liberty Resources.
This is Mary. I don't know the number right now, but I do know parenting with a disability issues have bubbled to the top again. And we're starting to do a lot of training and advocacy on it because we're finding a resurgence of this I can't think of a better word, just of the ableism out there still around parenting with a disability. So for example, Able South Carolina, is still out in South Carolina, and they do a ton of work on this. April has been putting out a lot of guidance as well. Just people still getting their kids taken away, for no reason.
Right.
And just that,
They can't imagine it's already hard for someone without a disability. So they think having a disability is impossible. So they have to protect the child. And that has always been the issue. We've gotten called in where at delivery, a blind couple, they were going to take the baby away. And then we were able to go in and do some teaching. And I think we need to, and I don't know if Through the Looking Glass are selling the DVDs. I have only one that's fully made and it isn't captioned, or they didn't caption it while I was doing it. But they can certainly do it, and it would show how parents are able to parent with adaptations or certain assistance. And that's a huge issue.
One of my early graduate school memories was helping Lynn Kester prepare to present some of the data from the Gallaudet study in Germany and getting it in German and just so. And she was presenting to a really large conference of infancy researchers about the importance of ASL in scaffolding cognitive development in deaf children. And she actually had a doctor stand up and shout at her that how dare you hold up deaf parents as an acceptable arrangement. Oh my gosh, yeah. And the conference organizers had to protect her and exit the person from the room.
I mean, this is why, in terms of television, we need more people with visible disabilities doing things. One of the interesting things is in England, there's a book out here that Alexandra has that came from England, and it shows about a vibrating cry alarm. We don't have it here. I don't know why. And I had to make one for a deaf parent who the light alarm would not wake her up. And so we were able to adapt a regular cry alarm to being a vibrating cry alarm. And it should be more out there. And why aren't we selling it? Why is it only well, it doesn't have to be only England, but that's the thing I know. So it becomes really important.
I want to just, I know that Molly Kimmel is with our assistive technology program. Molly, do you have anything to offer in terms of assistive technologies to support parents like Judi is describing?
Sure, Meg. Yeah, this is Molly. We have actually had quite a number of discussions among AT programs across the country on specifically technology for parenting with a disability. And so that is a category that our staff is working on developing, purchasing, and promoting. So if there are certain recommendations, we'd be glad to get them. There are some things that we've got on our wish list already and some things that we've heard about from people in the community about what they have used and found useful. So yes, please, I'll pop my email in the chat, but we welcome all sorts of suggestions and are really planning to make that a priority in this next year.
One of the things you should know, Molly, through the looking glass, I created, and now that I'm retired, but the newer OTs, what's out there on the market and how what's easily available and to what disability that particular item would be, that you might find it easier than reinventing the wheel because we were looking at things.
Great.
Thank you for that resource. I will go right there and merge those two things together. Thank you
And
so
if
much.
they don't have it, do you want to Meg, give my contact email, and I will make sure that when it's up and running, you get it.
Ah,
That would be wonderful.
yep.
Sure.
These are the types of products that are, I think Apple, Amazon, the larger tech companies are really learning more about inclusion solutions from the disability community and bringing them. Obviously, we have voice to text and text to voice that entered in from the disability community into mainstream, and we have many more opportunities to be learning.
Judi, are you involved at all with the folks from the Adaptive Parent Project?
No, where are they?
They're in California. That's why I was wondering. I'm going to connect you because she keeps reaching out to me. It started as a YouTube channel showing moms in wheelchairs how to do adaptive parenting. And now they're a nonprofit, and they focus on,
Yeah,
basically
Why did
accessible
they know?
disability parenting.
are they in Southern California?
I'm not sure where in California. Alicia Thomas is the woman there. I'm going to connect you.
So it's very sad that people don't know, and the problem with through the looking glass is not being able to spread out or know what's going on.
Yeah.
Because we've had at least 30 years of research and what products work.
I want to just open it up a little bit for discussion from the group
Great.
too, because I know that we have folks here in Montana who have been working on promoting access to reproductive health and the opportunity to be a parent or be involved in family. And I just want to make sure that we have some time.
I'm happy you don't.
I want to start with a really important question that Sam helped me frame and the discussion with, which is about the low expectations. And Emily Coyle posted it in the chat. Emily, do you want to give rise to that first question? And then, or Sam, if you want to come up, mute and just share some about being a parent with a disability and societal's low expectations and how that maybe affects your daily life.
Yeah, thanks, Meg. This is Samantha. So, one of the big things that I think we face with people and parents with disabilities is that societal low expectations. So often I get congratulatorial phrases about being a parent and when I'm doing basic parenting things like walking my daughters to their bus stop. And although thank you
For you.
congratulating me, but this is just simple things that we can do. And so I feel like it's those low expectations that make laws that used to be in place. And still, I know in Montana, there are laws still written in about blind parents, and there are possibilities of getting your kids taken away solely on the basis of blindness. They say they're not in practice at the time, but it's something that is concerning that language is still written into many state laws. And I feel like it is those low expectations that, people don't understand that we can, if you raise those expectations, you would see that what we're doing is just being a normal parent, just in a different way.
If we could get this into normal, not normal, but typical TV shows where they would include, so what we call visual history, where if I say to you, think of burping a baby, 99% would think about putting the baby over the shoulder. For many parents, that's not possible. Sitting the baby in the lap, and bending forward will get the burp out if you put the pressure on the tummy. It doesn't have to be over the shoulder. So if we can make YouTube more accessible where people would want to see this, or putting it on, having it in programs. Look how Crip Camp changed many people's viewpoint. And Crip Camp, was one slice of life. And we need to expand that. And I have taught people who have one hand, for whether I had a client with an amputation from cancer to CP to whatever, where we won't get to the video, but the baby lifts his butt up. So it's easier to slide the diaper under the baby. Why is this good for all parents? Because it stops kids from rolling over. And if any of you diapered, having children roll over, you want to shoot yourself and them, because makes diapering way longer.
Absolutely.
And then having a toy mobile where they are interested in lying still by playing with toys, interactive toys is another thing. And if that was there, it would show, oh, these people are smart.
Are there other examples from parents and others about societal low expectations for people with disabilities to be parenting, or to be aunts and uncles or teachers?
Hi, Meg, this is Shyla, and I know I'm a little bit late to the party, but I've always wanted to be a parent somehow, but I've worked with kids and before I got AL, and thank you, Judy, for coming, because I have a lot of but I have a lot of kids that have, and parents that have come to me through the CPS here in Montana. And I'm like, geez, if you would have told me about all the accommodations that are out there, I could have helped you keep your kid before things got into real trouble. Because I think a lot of times people just assume, oh, the person has a disability, whether it IDD, visual impairment, CP, whatever, and we can't do it. And even though I'm not having my own kids, I want to break the stereotype that parents with disabilities can be parents and have the right to succeed or fail.
One of the interesting things, and I thank you, and you could become a parent.
I could.
So you might want to think of it. My daughter, who kept putting off pregnancy because she thought she would find a partner, is 46, and she used someone else's egg and sperm because her eggs that we froze weren't viable.
Yeah.
And I even said to her, I wrote a book on pregnancy. You could adopt. There's a lot of kids, but
And you can. And my significant person and I are still discussing it, but having a lot of experience with people coming to me that are having issues with Montana CPS and their kids being taken away, I'm always interested in like toolkits, even though I haven't heard of every accommodation out there that parents use. And so that would be one of the things that I think of as low expectations, because it's for those without disabilities, it's not even on the table.
I have two different things. One is we need to have lawyers who are willing to work for free to help in family court. I actually have worked with a family that reached out to me. Both parents are blind, and the mother wants to move back to Oklahoma and not give visiting rights to her husband because it would be too stressful for the child, not saying she might miss her father. And I had to go find where he could go find an attorney. I mean, and this should be a right and it's not easy to find who will be pro bono attorney in family court. And it is as important as anything else.
I wanted, this is Meg, I just wanted to voice Matthew's input in the chat. In Pennsylvania, family court judges rip away parenting rights without an assessment. Disabled people have been exploited by other parents because they don't have negotiation power. Parents have been forced to sign over a house, agree to coercive sex just to have visitation. So Judi, I really like the way you raise our expectations, just that shouldn't happen, but here's the standard we want. We want to have lawyers who are facilitating pro bono the best situations for families.
Yeah. I think in terms of disability rights, parenting is the one place, or pregnancy, because it's still breaking down the barrier that don't want to shock people, but disabled people have sex. And sex can lend itself to pregnancy. And just to tell you, I have worked in the 21st century. I worked with a family of 2 trans males and one was pregnant. So anything is possible in this world now. The world has opened up. And the big thing is, and I find this the hardest, is actually when the child gets older and to discipline a child. Because we have, again, visual history. When I say you have a tantruming child, what do you do with a tantruming child? So what do you usually say?
Roll with the resistance. I go, I know. I know.
No, you put them in the room. Put the tantruming child in a room. But if you can't put a tantruming child away. Oh yeah. Oops. Yeah, that's what I do with my grandson.
And then it's yeah.
Oh yeah, I forgot. We are now, yes. Ding. Good point, ding. But yeah, most people then say, take him to another room, but I won't give you back your tablet, it's a good one. But what you can do is, it's the separation, not the child being in the room. You can leave and go into your room. And I've done this with parents, and the child goes, Mommy, Mommy. So it's really reconfiguring how things are done. It doesn't have to be the way we saw it.
Great.
But I like the tablet.
We have about 10 minutes left, and I know we've got some wonderful work going on in Montana. Rosemary, I wonder if you could just set the occasion to talk about how important our research is in terms of including people with disability in the data we collect and the research we do. And then I'd love to hear from Carly and Kara and just share a little bit with Judi about the work here.
I'm sorry, did you want me?
Just share a little bit about some of the work you've done with the PRAMS data or other, yeah.
So I was sharing with Judy, this is Rosemary. I was sharing with Judy that we're working with some researchers, very good researchers from the University of Virginia who are labor and delivery nurses and researchers. And we have been analyzing population-based data, which means that, so it's kind of random samples. And we've been looking at differences on certain outcomes between women with disabilities and women without disabilities. Like I mentioned, the difference was reproductive coercion, that's one. But we've also looked at depression during the perinatal period. There just is not a lot of research out there, and until we get the research, it won't get to the clinicians, and the clinicians will not be doing screening, for example, for reproductive coercion with somebody coming into their office, women coming into their office. So we found the same thing, that women with disabilities had 2 times the odds of depression during pregnancy and 2 times the odds of experiencing postpartum depression compared to women without disabilities. And I think it's really important to get that word out there. We've also looked at intimate partner violence during the perinatal period, and women with disabilities again had over 2 times the odds of IPV during pregnancy and during before pregnancy and during pregnancy. Now, I've done a lot of work on, as you know, probably most of my work has focused on abuse, interpersonal violence against women with disabilities. And also I've done some work with violence against people, men and women and other people with disabilities. But we don't really know too much about what happens during that perinatal period, during the time pregnancy starts to maybe 6 months after the baby is born. And the prevalence of violence is just huge. Also, so that we had analyzed data from the PRAMS data set, which is the pregnancy risk assessment monitoring system. And that is being also administered here in Montana. It was only in 2018 that PRAMS, that is administered by CDC, added disability questions. So I mean, it's kind of new, so we really only have a couple of years to look at that. But also we have looked at population-based data based on the National Survey of Family Growth, which is also administered by CDC. And these are administered by CDC and the states as well. And we looked and found that women with disabilities want to have a baby. They want to, but they don't intend to the same extent as women without disabilities, for all the barriers that are there for them, as Judy's talking about, the intention or the financial barriers and other barriers to having a child. And we also found out that women with disabilities have lower rates of access to family services. So that's another big one compared to women without disabilities. And the same thing with use of contraception. There are huge disparities, as Judi will attest to, between women with disabilities and women without disabilities on contraceptive methods. More sterilization still being used, and so I mean those are really important. And I think that the biggest, and we have also done several qualitative studies like Judi has done with interviewing women. We're doing one right now. But I mean, I think that until that happens, then clinicians will not, until they get the word, will see women with disabilities as not as vulnerable. Like Judi said, women with disabilities are having sex. So yeah, well, what about intimate partner violence then? That is so important to make sure that the perceptions change and the practices change and policy changes. So thank you for listening.
Wow. Thank you for doing the work, because I have not done that, and clearly the work needs to be done.
It does.
I wanted to ask, Kara, do you have anything to add from the Montana perspective?
Yeah, absolutely. I don't know how I follow up from that. That was amazing. Very well put. So hi, everyone. Just a reminder, I just started in the PRAMS program. I'm the lead epidemiologist. I may butcher this a little. I'm relatively new in this, but yeah, I'm going to drop it in the chat. We have a link to the data brief that was created based on the questions that we placed in the PRAM survey in 2018. And the data brief covers 2018 to 2020. And Montana, I'm very proud to say, elected to add these questions to the PRAM survey and collect this information on moms. And now, because of some of the work we've done in some of the other states, it's now going to be part of the core questions across the nation. So I foresee a lot more data coming from this. And as mentioned, we look at these moms with disabilities and their health outcomes. So, everything from contraception to vitamin intake to depression. And just like was mentioned earlier, we are seeing many of the same outcomes here in Montana, if not even worse, especially when it comes to depression, access to care. Again, it's just a challenge. And just so you guys know, like I said, I drop it in the chat, but these questions are based on the Washington Group short set of questions on disabilities. So there's 6 questions that assess difficulty in seeing, hearing, walking, remembering, self-care in general, and communicating. And the responses range from no difficulty to cannot do this at all. So then we're looking at the individuals that answered, on the higher range of this, and then what kind of outcomes we're seeing with them. And so I'm excited to get a few more years of data and get a better picture of this. But these are the conversations I think we should be having. I'm so thankful I was invited to be a part of today. Thank you, Meg. She's the one who thought of me being here. And so, this pushes the work. It informs policy, it informs clinicians, and we need to keep talking about this and keep talking about the data and how it can be used.
Thanks, Kara. We have just a couple more minutes, but so much of our work is about not just understanding that there are disparities, but addressing the root causes of disparities. And so Carly Holman did a beautiful job at just including some questions about accessibility of our healthcare centers. Carly, are you on to share just a little bit about?
Yes,
that?
yep, I'm here, happy to share. I'll do so quickly, but feel free to reach out if anybody has questions. But as part of our work on some maternal health initiatives in Montana, we've been doing a lot of partnering with hospitals on their capacity around obstetric care services. So looking at staffing, equipment, services available in the facility. And we did a statewide assessment. It's called the Levels of Care Assessment Tool, where we added questions on that structural assessment about facility capacity to provide accessible perinatal care settings for perinatal patients with disabilities. And so this information has been really helpful to us in the work that we've now been doing with hospitals as we're integrating education and training on facility accessibility for perinatal patients with disabilities into some of our quality improvement initiatives through the Montana Perinatal Quality Collaborative, and partnering with our colleagues at Montech to provide some really great education and training to these healthcare providers, but really making sure that we are including the conversation of perinatal patients with disabilities in a lot of these maternal health initiatives that are occurring both statewide and nationally. So that's a quick summary of some of our work.
Are you looking at not only transportation, but transportation that the parents can take kids? Because I have seen that as so hard because of having more than one child. Carrying car seats is a huge issue, and you know better than I how rural life doesn't really have accessible transportation as much.
Thank you for the question. We have not looked at that. At this point, the work we've done is pretty preliminary, focused specifically within that hospital. So do they have accessible medical diagnostic equipment, communication aids and services to support effective communication? So we're looking within the hospital itself, but I think that's a really important point as we kind of move this work forward.
Really good point. Thanks, Judi. This is Meg. These are large data, right? And it is really important for us to contextualize them and bring them to our disability-led organizations, our centers for independent living, And bring those to our peer groups and to be really helping to understand what do the data mean here in our communities in Montana, and what can we do about the data. So thank you for the work. Thank you for Judi being here. I'm not sure if our ASL interpreter and captioning team can stay on, but for folks who are available, we could stay for one more video. Bonnie, are you available to stay for another 10 minutes?
Unfortunately, I cannot. I have another appointment right now at 4. I'm sorry, I have to go.
That's
I'm sorry,
okay.
Kirk.
How about our captioning team?
Another time I'll come back and.
We'll do it another time. Okay, great.
I'll come and
wanna
visit
thank
you in
our
the
ASL
summer.
Interpreters for being here, our captioning team for being here.
Really
Thank
close
you
for
to
them. I just learned
everybody,
today she has to have a message.
for your work in this space. And Judi, thank you for setting a course for us.